Good evening and welcome to Milford Regional Medical Center. And for some of you, welcome back. I am Donna Boynton from the marketing department. Tonight is part 2 of our lecture series on hip replacement surgery. And tonight we're going to focus on physical therapy and occupational therapy and the importance of each in your recovery. Our physical and occupational therapists work at Milford Regional Rehabilitation and Sports Medicine, and there are 3 locations. We have a location in Milford, one in Franklin, and one in Northbridge. Tonight we have with us Renee Halliday, who is a physical therapist, and Julia Caruso, who is an occupational therapist. So they're going to take you through before and after surgery, give you some helpful tips, and I can turn it over to you now.
Okay, thank you. Like she said, I'm Renee Halliday, and this is Julia Caruso. We're going to be discussing what to expect after having a total hip replacement. Okay, as Donna said, we do have 3 locations for our rehab facilities. Our Milford one is at 42 Cape Road, which is just half mile down the street by Papagino's and CVS. We have our Franklin clinic that is right by BJ's, and we have a Northbridge clinic that is right by Osterman Oil. So, we accept almost any insurances at all of our locations, and being a post-op patient, meaning right after you have surgery, you would get immediately into our clinic. You would not have to wait. We're used to dealing with surgeons from throughout the whole state of Massachusetts, so it doesn't matter who your surgeon is. We're happy to take care of your rehab needs. So, why are you here? Most of you are in a lot of pain. That being said, if you need to change positions while I'm talking, you need to stand, you need to walk around, please do so. It won't hurt our feelings at all. We'd rather you be comfortable. So most of you have tried conservative approaches. You may have gone to therapy, didn't work. You may have had injections, they did not work. You may have done acupuncture. You may have put Bengay on, cold pack. Well, they're not working, so now is the next step. You'll be happy to know, though, most patients with a total hip replacement are so happy in a short time after the surgery. I have many patients who tell me just a few days after surgery that their pain is much less than it was before surgery. Your pain that you will have post-operatively is not that arthritis pain anymore. It is a post-op type of pain, which is usually not as bad, it's not as deep, and it's something you can control. Right now, you probably cannot control your pain. The post-op pain you usually can control with cold packs or medications. So, how can we recover faster? Positiveness always helps a lot. So if you have a positive attitude, realize that you will have some pain. It's not going to be horrible, and that you need to do a lot of hard work, and you'll be fine. Everyone heals a little bit differently and recovers a little differently. So the healthier you are prior to surgery, the better you'll do after surgery. If you're a person whose blood sugars tend to run a little high, if you can get those under better control before surgery, you'll be better after surgery. Some surgeons will ask you to lose some weight prior to surgery. Having an ideal body mass does help. For every extra pound you have, it puts 3 pounds of force on your hip joint. You don't want that extra 3 pounds of force on you. I know most of you are saying, how the heck can I exercise? I'm in so much pain. We will talk about that through the lecture. Activity, again, as high level of as an activity that you can do without putting yourself into extreme pain is great. So your expectations post-operatively is some post-surgical pain. In general, you are done with therapy in 1 month, some people as much as 6 months. It's going to depend on what kind of shape you went into before the surgery. If you go in strong, you're going to come out strong. If you're going in really bad shape, just having the hip replacement is not going to change your life. You're going to have to work really hard to get where you need to be. I've had a few patients who actually went and played golf a month after their surgery. It was pretty amazing. And that's not generally how it goes, but it does happen. As far as support, you will need some friends and family to help you right after surgery. You may not be as quick going up and down the stairs. You may need someone to drive for you. Often surgeons do not let you drive for between 4 and 8 weeks post-operatively. In general, it's about 6, depending on your surgeon, but 4 to 8, depending on how things are going. So you're going to need someone to help you get around. You're going to need someone to help you do some grocery shopping. If you have very steep stairs to get down to the laundry, you might need somebody to help you do some laundry things. So try to schedule some friends and family to help you for the first few weeks after surgery. Commitment. You need to be committed. Just having the surgery doesn't mean everything is great. You do have to put work into the therapy to get better. I'll talk a little bit about getting ready for home preparation as far as it relates to physical therapy, and then Julia will go over how it relates more to your activities of daily living. So as far as physical therapy with home preparing, is if you can go to your senior centers, and I'm going to give you your senior centers' phone numbers and what they have at them. You can pick up a walker. Most likely you will get a walker here in the hospital that is covered by insurance, but let me tell you, it's very nice to have an extra one if you have a lot of stairs. It's nice to be able to keep one on the second floor and have one on the main floor. Your insurance will not pay for 2 walkers. Or if you know you're going to be going to a daughter's house or son's house and you know they have multi-levels and that's where you're going to be staying for your recovery, having that second walker is nice. So often the senior centers will have walkers, they'll have crutches, and they'll have canes. They say that you can borrow them. They do not have a timeline on it. They are not calling you up after 3 weeks and say, bring back the walker. If you need it for 6 months or a year, you can keep it. They're fine with that. If you don't need it anymore, they just ask that you bring it back. How many here have used cold packs on their hips? Good. I hope you all still have them. That good, at least one does. So cold packs are great. I would recommend with the hip, if you can get as big of one as you can. M&M Medical carries a very extra large size ones. Sometimes CVS will have those as well. It's good to have 1 or 2 of those. That way you have one, if you have 2, you have one that's already always cold and ready to go, because you have a larger portion to cover with that cold pack. So the little mini ones this big are somewhat helpful, but not helpful enough. So a large cold pack is awesome. You'd want to keep a pillowcase near your freezer where the cold pack is. Most people put the cold pack in the pillowcase, and then you put the pillowcase right on the area. You don't want to put a cold pack right on the scar. You don't want to have freezer burn. You have scars and a skin that needs to heal, so you want a little protection there. Other things for home. Let's see. Supportive slide-on shoes. You can have sneakers if you want, but you're going to be a little fatigued after the surgery. It's going to be a little difficult to get those tie-on shoes on. Julia will give you hints on how to do that. But I brought a pair of slide-on shoes that I have. They don't have a back, so they're very easy when you just want to put them on. They have some good arch support, and then you can be walking around in those. Sneakers, again, are great, but they are a little bit difficult to get in and out of. Slippers are not great. Most slippers are not very supportive. It's nice to have some supportive shoes. A lot of the ideas I'm giving you are based on evidence-based research. It's also based on our clinical experience. It's also based on what our patients have told us, and many of us therapists have had family members who have gone through this. So we've tweaked, I'm tweaking what I'm telling you now based on personal experience. We also have therapists that work for us who've had total hip replacements. They have been a great person to get resource and information from. So they all love the slide-on shoes. So this surgery is considered an elective surgery. Because an elective surgery is not a surgery where it's urgent, you have to have it today, life or death. You are choosing to have it. You can usually kind of choose the date you can have it. So you can do a lot of planning before your surgery so you're ready. Not only planning on, the shoes and the walker and the cold packs, but planning on strengthening and getting a little more active before surgery. Most of you are in so much pain that you're like, there's no way I'm exercising. I already went to therapy. It was terrible. I hated it. And I just need the surgery. But there's a lot of evidence-based research that shows you need to exercise before you go. So if you're not doing well walking on the land, which most of you probably aren't, you may just want to go to a pool. You do not have to swim laps in the pool. Walking back and forth in water that's chest height is a great exercise, and you will not feel much pain at all on your hip. And then you can increase the speed of that walking. You can do leg lifts in the water, to the front, to the side, to the back. Again, these are things that might hurt you on the land, but in the water, you'll be able to do them with ease. Tonight, we are going to do show you the exercises that you should be doing preoperatively. They are also the exercises you will be doing right after your surgery. So they will be ingrained in you. So when the therapist says, do this, you'll be like, oh, I know how to do it. And you can do it well. Most of these exercises that we'll show you should not really hurt much at all. You should be doing some kind of cardiovascular exercise at least 3 days a week. If you don't want to join a gym, you feel like it's too expensive, I have a list that I will give you of all the local senior centers. Some of them have trainers available. Some of them have chair exercise class that are available. Some of them have Tai Chi for balance. Some of them have bikes that you can go in and use the bike or the treadmill, and that's all listed for you. So you can call them, and whatever information they provided us with, I just put in an Excel spreadsheet so you had all of it. Some of you, if you haven't been to therapy, may need therapy before surgery just to get a little bit of a tune-up and make sure you have the exercises all down. So again, the stronger you go in, the stronger you're going to come out. When I give you the exercise packets, I will demonstrate the exercises with Julia, and then I'm going to have all you guys do them so you know what they are. Nutrition. Nutrition is very important. We are not registered dietitians. If you feel like you need a spruce up on that, you can ask your doctor to have a consultation with an registered dietitian. Basically, you want to eat healthy before surgery. That helps with the healing process. You want to stay hydrated. That's water, not beers. Sorry. You need protein to help build muscle. So proteins are lean meats, eggs, beans, nuts, etc. Fiber, this is very important. Post-operatively, you may be taking some pain medication, and that sometimes can give you constipation. So you want to eat some whole grains breads or cereals, beans, broccoli, avocados. All of those can help with the increase in your fiber and helping avoid constipation. Iron, you want your blood to be nice and full of good iron, so you need lean red meats, leafy greens, and then we don't want to forget about vitamin C's, and then calcium to build those strong bones. And now Julia is going to talk to you about preventing dislocations.
So you all should have a packet that I put on your chair when I first got here. Do you all have that? And it talks on the front page about the precautions that you're going to have to abide by after you have your surgery. These are really important. They're going to be ingrained in you. You're going to dream about these precautions because you're going to be told them over and over again. So I have some graphics up here as well to kind of help you have a visual. So the first one, no bending your trunk forward more than 90 degrees or lifting your knees higher than your hip. So a good rule of thumb is to actually, if you go any lower than your knees, so right now I'm touching my knees, I'm pretty safe here, right? But if I go here, I'm breaking that precaution and I'm at a risk of dislocating the hip. Also, you don't want to bring your knees up past your hip. So if you're sitting in a chair, this is where it's really important. You have to consider what that angle of your hip is. So it's a chair, a toilet, a bed, any seating surface is really important. So I have a little rule of thumb that I like to think about. If you were to put a marble on your thigh, that marble should roll right down your knee. If it does, the chair that you're sitting in is appropriate. If not, you're at risk of breaking your hip precaution and dislocating your hip. So if you look at the chair right now that you're sitting in, some of you could be okay. Some of you probably not, right? What would happen if I put a marble on your hip? Yeah, let's try it. Right? Yeah, rolls off to the side.
You lost your marbles.
I lost my marbles. So that's a good indicator. Is just kind of imagining that. How would that be? So when you go home, you want to look at your seating surfaces in your house and make sure that they are going to be appropriate for you once you're done with your surgery. So then the second one is not bringing your operated leg past midline. So when do we ever do that? Well, the big one is crossing our legs, right? So it's a hard habit to get out of, but if you can start thinking about that now, we really don't want you crossing your legs because, again, you're kind of putting too much stress on that hip and you're at risk of dislocating it. The last one is do not rotate or twist your operated leg inward. So like this. So when would you do that? Well, if I had to reach back over here, I might be turning my leg in. So all these little things. Occupational therapy, we deal with the nitty-gritty as far as your activities of daily living. One of those is toileting, and so I have to bring this up. Using the bathroom, if you have to reach behind you, that's something to consider. If you're right-hand dominant and you're having your right hip done, you want to think about that because if you're reaching behind, you might be breaking that hip precaution, okay? So all these little things, it's good that you're here because you can kind of get into the habit of practicing this stuff now. Okay, so preparing your home before surgery. This is really important as well. The first thing that I have here is setting up your traffic pattern. Avoiding having a lot of clutter in your house. If you have boxes or things like that, you're going to be walking around with a walker. This is a standard walker right here. And if you're walking down a hallway and you have shoes on the side and you have bags or anything, you don't want to be at risk of falling and possibly breaking the other hip, or we don't want to add insult to injury here. So it's really important that you kind of clean that up and be prepared for it. The second thing is removing any type of throw rugs. So I'm not talking like your dining room rug. I'm talking about loose throw rugs, things like a bathroom rug, something that could get caught on the wheel of your walker. You want to be conscious of that. Again, we talked about sitting. So things like sofas, they're out after your surgery. No sofas. No recliners, okay? So think about the way you get up out of a nice, soft sofa. You're kind of sitting down in it, and you have to lean forward. And right there, you've already broken that precaution. So we say avoid it. Some people have talked about putting, lifts on there. I think it makes more sense just to find a sturdy, comfortable chair that you can sit in. And I put the picture up of the dining room chair because I love the way that they are. They have the armrests there. They're nice and tall. You can put on a foam mat if you need to raise it up, or some towels, something firm. But that's a nice, sturdy chair that's going to be safe for you to get in and out of. The recliner, it's the same thing, but it's also because, recliners, you kind of sink into them, right? That makes your hips roll inward. So you're just by sitting in the recliner, you're at risk of breaking the precautions. So I hate to break that to you, but it's one of the ones that you want to talk about. Yep. You have a question? That's a really good point. She was asking if this is a precaution that you have to deal with forever. You always have to be thinking about this. You'll always have to think about it. But as your surgeon progresses you won't have to be as strict about it. Generally, the first 6 weeks is when you really have to be diligently thinking about this all the time. And then you'll follow up with Dr. Barrett or whoever does your surgery, and you will get progressed to the next level. Okay. But it is something that you do have to think about because you're always at risk. This is, as your hip is rebuilding muscle and tissue. So then the bathroom. So again, seating surfaces. The toilet height. A lot of toilets, though, I find, does anybody have those comfort height toilets? A lot of people have those. They don't even go with the standard low toilets. It's like a raised toilet already. So if you sit on that and you can, the marble will roll right down your leg, you're good. But if not, you're going to have to get something for every toilet that you're going to be using in the house. So I put in the packet things that you can consider. Raised toilet seats. They actually attach right to the toilet bowl. And I like the ones that have handles on the side because the more that you can use to push up with your arms to compensate for your leg, the better. The other option is getting a commode and taking the bucket right out of it and putting that over. So, it's really each his own. If you have family members that have them or that you're holding on from somebody else, that's great. You used to be able to get them at the senior centers. Some of them still do. I know Milford does not loan them out. You can check with the Blair House, I believe they said to me today. I just wanted to double check with them, but you can check with the Blair House. You can check the Blessing Barn. There's like little consignment shops. I've seen them there. Go online, that kind of thing. But this is something that's not covered by insurance, and it's frustrating. But generally, commodes are not covered, even though for most of you, it's going to be a necessity. Let's see. Then the shower. Okay. So how many people here have a tub that they have to step over to get into the shower? Wow, a lot of you. And then how many have a shower stall? Just a stall that you can walk into? Just one. Okay. So for those of you that have a stall, a shower chair is fine if you need it. You may not need it. You may not need to sit down. But for those of you that have the tub, what are we thinking about? Can anyone read my mind here? What I'm thinking about getting into the tub? The angle, yeah, stepping over the tub, right? Plus safety. I don't really want you balancing on one foot if we can avoid that. So I really like the tub benches, which is shown in that picture. And basically what you do with those is it has 2 legs inside of the tub and 2 legs outside. And you can just easily slide right in. You can lift up your leg. You'll know how to get in and out of bed. It'll be very similar. So those are generally the safest. Having a handheld shower head can be really helpful too. And then grab bars. I basically recommend grab bars to every person that I see just because I think they're safe and they're nice to have in there. So I did put some stuff in there about grab bars, but just to give you a little bit more support while you're in there. And what's nice about these tub benches is that the legs are adjustable, just like on a walker or commode. So you're going to raise that tub bench up to the same height that you would if you were sitting in a chair. Okay. And by the time you leave the hospital, you're going to be so good at doing those transfers because the first obstacle is going to be getting in and out of bed. You're going to have to learn how to do that. By the time you leave here, you're going to be a pro. You're going to know how to do that. Okay. And unfortunately, you're not going to be able to take a shower for 10 to 14 days after the surgery anyway. So you'll have a little bit of time to kind of heal and get more comfortable. Just some kind of more things about preparing your home, keeping things that you need access to a lot within close reach. So you don't want to have your most commonly used pasta pot underneath in the lower cabinets. Put them up higher. Put them on top of the stove. Have them accessible. Also brought my reacher. Okay, this is a dream. I love this. So what I like about it as well is you can put it right in your walker. So if you drop your phone when you're walking, you don't have to bend over. You can just pick it right up. Okay? So this is a really handy tool to have after your surgery. Might even be handy now. A lot of these might be handy now. Keeping your hands on the walker at all times when you're ambulating around your house. So that means if you need to go into the kitchen and get a drink, you don't want to take your hands off of the walker, right? So a lot of times what people will do is they'll either attach a basket or something to the front of it, or they'll set up a cooler, over by the living room or wherever they're going to be spending their time during the day so that they don't have to keep going in and out of the kitchen. They have easily accessible snacks, things that are right there. You're not going to be going in and up and getting up and down if there's not going to be someone home to help you. Meal prep, preparing meals prior, freezing them. Laundry and cleaning, have someone else do it for a while. You don't have to do it for a little while. We don't want you carrying big baskets of laundry and trying to carry it with your walker. Okay? So delegate if you can, and prepare as much beforehand if you can. Dressing and bathing. We talked a little bit about the shoes, slip-on, supportive. You're going to want to keep your clothes as comfy as possible. This is a time where you can wear sweatpants every day, yoga pants every day, and be completely fine with it. Elastic waistband pants, things that are going to be easy for you to get up and down and that you're not going to have to fight with, okay? That is extremely important when you're leaving the hospital, okay? Because you're going to have swelling in the hip. You're going to have swelling in the leg. So trying to fight on big or tight clothes or tight jeans or anything like that, that's not going to be a priority right now. So try to keep it as comfortable as possible. And then in your handout as well, there is a whole section about adaptive equipment. How many people here now have trouble putting their socks and shoes on? Yeah. So I always hear that. I work here in the hospital, so you'll see me or my coworker, Katie, right after you have surgery. So I work right here. And one of the things that I hear when I show this equipment to people is, I wish I had that before. I can't get my socks on before I had the surgery. So this is some tools that I have here. This is my favorite. It's a sock aid, okay? And I can show you all how to use this after when we do the exercises. But this is a really handy thing to get on. It completely prevents having to bend to put your socks on. You can do it sitting in the chair. You don't have to bend over. It takes 2 seconds and you're done. Same thing, I have a long-handled shoehorn, a dressing stick. You can invest in elastic laces if you really do want to wear shoes with laces in them. That way you don't have to tie them. And then this is a leg lifter. I would say most people in the hospital do not need this. But if you are having trouble getting your leg in and out of bed, this is a tool that we'll be recommending for you, and we'll practice with you while you're here. So the question is, would the occupational therapist or physical therapist recommend this? I'm recommending it now. Okay, so take this as your recommendation. You can have someone help you put your shoes and socks on, and I hear that all the time. Oh, my husband will just put my socks and shoes on. So, and that's totally fine. That's completely up to you. But there may be a time where you're going to want to put your own shoes and socks on, and if these precautions go past that 6-week period, it might be nice to kind of have another option. Okay, things like the reacher that. I have them. My kids have reachers. We use these all the time. I just think that they're handy. But stuff for lower body dressing, you're absolutely going to need something. Think about also putting your pants on, right? Most people bend down or they bring their leg up to put their pants in, and you're not going to be able to do that. So you're going to need something like a dressing stick or a reacher to help you dress that operated leg. Okay. Did you have a question? Where is M&M Medical? So that's on Route 16 in Mendon. Is it Mendon or I think it's Mendon. It's right on the Uxbridge line where George's Surf and Turf is. Yeah, it's right across the street. Any medical supply store. Hopkinton Drug has a lot of this stuff as well. They have a really good selection. I go online a lot as well. You can go on Amazon.com and look up a total hip kit, and you'll get all of these tools plus a long-handed sponge, and it will be like $28. So it's worth the investment, especially if you're not only having one hip done. A lot of people have to have both hips done, so you're kind of investing in a second surgery. Well, that's a good question. So if you don't move your thigh, you don't need that stuff, right? But the precaution is at the angle where the hip is. So not only can you not move the thigh, but you can't bend like this. So when we're talking about dressing the lower body after having any hip replacement or knee replacement, you always want to dress the bad leg first, okay? And you always want to do it while you're seated. So we'll pretend that this is a proper height chair for me. But if I have my pants and I have it's all bunched up and I have the pant leg here, I'm going to use this to bring that pant leg up onto my affected leg. Once I have it, I can dress this leg. I can move this hip because this one's not the one that has the precautions. So you always want to dress the bad leg first. You're going to have your walker here with you. And you're going to get your underwear and your pants up as high as you possibly can, okay? And that's why the elastic waistband really helps as well. You're going to have your foot up. You're going to get up safely to the walker. You're inside the frame, and you're going to be able to pull your pants up here. And it's the same thing with taking them off. You take them off, you pull them right here, sit down safely, and then you're able to use your dressing tools to get them off, okay? And we wouldn't expect you, thank you. We wouldn't expect you to, this isn't your one time here, hearing this. You're gonna hear this over and over and over again. But hearing it now, you're gonna be like, oh yeah, I remember when she said that. And even if you have a little bit of practice with this stuff, it's gonna make it so much easier for you. And I can promise you that. Again, it's going to be up to your surgeon how much more, how much you're going to be able to do as far as your hip precautions. But hopefully it's not something you're going to have to use forever. But it might be easier. And like I said, some people are here, going to have both hips done, and you might really just get the hang of using this stuff, and it might make it easier. So a lot of this is basically just a review. She went over all of this with you, how you're going to meet with your specialists, you're going to meet with your primary care physician, you're going to have pre-admission testing, things like blood work and urinalysis and a baseline EKG so we can see what your heart is doing now. We're also going to get information about medications that you may be on. Dental work. You're going to want to have that done at least 1 month prior. Does everybody know why that is? Because of the infection, yeah. So something I just want to say really quick, it kind of relates to that, is ladies, if you get pedicures done, be really careful where you go, okay? Because that's another really easy way for bacteria to enter your bloodstream and to infect that hip, okay? That's going to be a precaution forever, okay? Because it doesn't have a blood supply. So you're gonna do the shower with the special soap, right? And then the day of the surgery, it's gonna be an hour and a half, 2 hours, but it'll feel like a blink of an eye. You're gonna wake up, you're gonna have an IV, you're gonna have a urinary catheter. That won't be removed until the second day post-op. People love their catheter because it makes it easier for them. You're also going to have an abduction wedge. This is your abduction wedge. You're going to be sleeping with this, okay? When you wake up, it will be attached to you, but we're gonna give you a little bit more leeway as the days go on in the hospital. Okay? And so this is another pillow that we use to prevent you from dislocating that hip. Okay? The other thing you're going to have is your compression TED stockings. These are to prevent blood clots. These you will need help getting on and off. And you're going to wear them every day, even when you go home. Usually it's about 2-3 weeks. Take them off at night, rinse them off in the shower, little light detergent, hang them to dry, have someone help you put them on the next day. Okay? And we'll go over all of that with you as well, how to get these on. Yes, it keeps you from, the pillow is to keep you from bringing your knees together when you're sleeping. Okay, so this is for when you're in bed and you're laying on your back. It's going to be between your legs. Okay, that way you don't inadvertently bring that leg in past midline. Not forever. No, but we don't want you, it's again, it varies with the hip precautions. So how long Dr. Barrett or whoever the surgeon is going to keep you going on those hip precautions, because if you lay on the unaffected side, your leg naturally comes in. So you have to be really careful with that, because if it comes into midline, you're at risk again of breaking that precaution. I gotta tell you, it's not as bad as it looks. I know these sound like, oh my gosh, I don't want to dislocate my hip. I have rarely seen people come back with a dislocated hip. I really haven't. So a lot of these things you probably already do because of discomfort. It's probably not comfortable for you to bend down and touch your toes, and probably hasn't been for a while. So it's not going to be a huge adjustment. And like I said, you're going to get used to it. Okay. I would say, what's that? The abduction. That won't be forever. It won't be forever. Any other questions about this stuff here? Okay. Okay, so inpatient rehab. So this is where you'll meet me and my physical therapist friends. You're going to get up on the first day of surgery. So you're going to come back from the operating room. We're going to give you some time, and then we're going to get you up. Okay, it's really important to get your lungs moving, get you mobilized. Research says that makes your recovery easier, but the biggest thing is we really want to get you in an upright position so that your lungs, you don't get pneumonia. Okay, even if it's just to the chair, you may just take a couple of steps from the bed to the chair and sit there for 20 minutes and then go right back to bed. But we're going to do the best we can to get you up that day. And then you'll be meeting with physical therapy 1 to 2 times a day. After that, you'll be walking up and down the hall with your walker by the second day. By the day that catheter comes out, you're going to be walking up and down the hallway. And you'll be practicing stairs with them as well. You'll be using crutches and practicing stairs. If you're going home, you'll see me 2 to 3 times, starting on post-op day 1. And we'll be practicing dressing, and we'll be doing all of this stuff. And I'll repeat everything I've said tonight. A little bit more condensed, but I'll repeat everything I said tonight so you'll have all this information again. And we're going to work on all of those things, dressing, toileting. Sorry, no shower for 10 days. If you go home, the nurse will take your staples out at the house, and that's when you can shower. We want you to plan your pain meds accordingly. Do not be a hero, okay? Your nurses have a lot of patients, okay? And they're not going to come every 4 hours and remind you to take your medication. If you can stay on top of the post-op pain, you're not going to be as uncomfortable, and you'll be better able to work with the therapists. Because if you get behind it, if you get behind that pain, it's really hard to catch up. So, you know, this is a hip replacement. There's nothing wrong with taking the medication. Stay on the routine, stay on the regimen, and work with your therapists, and you'll be fine. But find a way to remember that. You're going to have a case manager. She's your cruise director. She is going to be the one that will order your walker that you'll get. She's also going to be the one that's going to help you determine which rehab you want to go to, if you are going to go to rehab. And she's also going to set up your in-home services. Okay, so all of that stuff will be set up for you. Is anybody thinking about going to rehab after the surgery? Okay. Is anybody kind of up in the air about it? Or is most people saying, I'm going home? If you live, exactly. So these are all things that you want to consider. If you live alone and you don't have a lot of support, going to rehab for a few days is a great option. Okay. You don't have to decide that today. It's good to have an idea to say going into it, I want to go home or I want to go to rehab. But at the end of the day, it's really going to matter how well you're moving, and we're going to help you figure that out. Somebody who says I'm going home, and if they're not moving very well, we may really try to convince you to go to rehab for a couple of days to just extend that recovery a little bit. Your car ride home, this is really important to think about. So again, I'm going back to those precautions. If you have a low car, getting into a low car is going to be really difficult after a surgery, if not impossible. Okay, SUVs are your best options, no really high trucks, but think about how are you going to slide in. Getting into a little Miata may not be a great option at this time. Okay, I'm going to pass this back to Renee. She can talk about outpatient physical therapy.
Okay, so you are now finished with Julia. You are now home. That's great, but now you might be by yourself. So what's going to happen? You might have the visiting nurse coming to your home. If you're young, they usually try to send you straight to outpatient because we have more tools that we can use in an outpatient setting than you usually have in your own home. When you come to outpatient, you'll have a thorough evaluation. So we will check how you're doing, basically, how you've improved since the day you had your surgery. If you had your surgery at Milford Regional, we have complete access to your medical records. We can look at your operating report. We know how your inpatient stay went, which is very helpful. It could be seamless going from one to the other. When you come to outpatient, we'll evaluate how strong you are, how much range of motion you have, how is your gait or how is your walking, and how is your pain, how is your function. So these are all things that we can work on at therapy. We may be trying to decrease your postoperative pain. We may be trying to get you a little bit more range of motion. We may be trying to get you a little more strength. One thing we do is we ask you, what is your goal? So what your goal is more important than what my goal is. You may say, I want to be in a golf tournament on June 1st. And we will try to gear the rehab accordingly to get you to that goal. Your goal might be, I just want to be able to walk to my mailbox. We will work on that goal. So think about that before you come to outpatient. What is your goal? What do you want to accomplish? It doesn't have to be a big one. You might say, okay, I want to be able to make it to my mailbox. And then you do that and you say, okay, now I want to be able to make it around the block. So whatever your goal is, or I want to be able to get up and down the stairs without anyone helping me. So whatever your goal is, that will be your individual thing, and we will work on you individually to get to that point. In outpatient, we have many different kind of modalities and diverse things to help with pain. These are things that aren't necessarily available when you have the visiting nurse. They don't have all these machines that they can just carry around in their car. Most people come to therapy about twice a week. So, does that mean you should only exercise twice a week? Absolutely not. Your therapist will give you a home exercise program, and that will be specific to you, but usually it is something you need to be doing daily. Again, a little hard work is going to get you at a great outcome. When you come to therapy, you will be there between 30 and 60 minutes. It's going to depend on how you're doing that day. If you arrive 15 minutes late, you probably will not be there for 60 minutes. So it's important to be on time and be prepared, like come with the proper clothes on. High heels doesn't really work too well in PT. So having some loose exercise equipment, clothes on is great. Our goal is that when you come to outpatient, the therapist who starts you the first day is the therapist who finishes with you when you graduate the last day. Again, the rehab can be anywhere from 1 month to 6 months. Depends on the individual. Unfortunately, sometimes it depends on your insurance. Some insurances have less of a benefit. We try to work with you as far as the insurance. If we know your insurance only will approve 12 visits, we'll try to space them out accordingly and give you new things to work on each week at home. So when you come back the next time, we can then advance you again. You can pay out of pocket if you need more visits. Some people definitely pay out of pocket if they need to. And it's very individual about the insurance. Everyone's plan is so different, it's hard to tell, but we do help you find that information out as well. Ballpark for how much it costs? Yeah. For our facility, the ballpark figure for out-of-pocket depends. Usually if people have been coming and using their insurance, and now you've used it all up and you have no more benefit, at this point, as of today, the hospital will charge you $50 per visit to continue. I don't want to say what will happen, in January. So the question is the copay for the insurance. Every plan is very, very different. My plan, I have like a $500 inpatient stay deductible. Some people have zero. So you'd really want to call your insurance company to see what you're out of pocket. Medicare or Medicaid? In most cases, not all, but a lot of them, Medicare pays about 80%, and usually your secondary insurance covers a good portion of the rest of that 20%. But it's always good to check. You don't want to be surprised by any bills. I'm going to hand out the exercise sheets, and I'm going to hand out the information about the senior centers. So with the exercise sheets, as promised, Julia will be the model on the table. And then you'll all get a chance. If these are too easy for you when you get home, you might be a person who might benefit from a little bit what we call prehab. That is rehab or PT prior to surgery, because we might be able to give you some more advanced exercises that you can tolerate. Ask me the brand of the shoe that I put on. These particular ones are Merrell. They have a non-slip bottom, so that's one reason I like them. And they have an arch support, but any shoe that you can get on easily is fine as long as it has some support for you. And another thing about the abductor pillow, if you are a person who loves to cross your legs, sometimes when you're sitting, we'll put it this way just to remind you not to cross, because we all have that habit of crossing our legs. And it doesn't matter whether you're crossing at the hips, or we had a few people who had their legs crossed at the ankles. That's a no-go. And again, every surgeon has different precautions. We have some surgeons who, after 6 to 12 weeks, say you never have to do the precautions ever again. We have other ones who say you do need to do it for most of your life. So it's very surgeon-based. Now, the first exercise we're going to do is called the quad set. Quad set, it's called that because it's strengthening or tightening the quadricep muscle. If possible, in the hospital, you're going to be doing these laying down. So I'm going to show them to you laying down. What's that? A very, very comfortable table. Luckily, she's tiny. So on this exercise, you're laying on a firm surface. You can do it on the bed. I would recommend, if you want to do it on the floor, only doing it on the floor preoperatively, not postoperatively. You can do it on a supportive bed. That works fine. She's going to be tightening these quadriceps. How is she going to do that? She's going to push her knees down into the bed or the table. Okay, tighten and then relax. And you may as well get both sides strong while you're doing it. Don't let the other one feel left out. And again, she's pushing down and she's strengthening all in here. This is an isometric exercise. This should not hurt any of you. Okay, so the quadriceps start way up here, they come past the knee. The next exercise is called a glute set. Anybody know where their glutes are? Yeah, so your gluteus maximus back there. So you want to squeeze your buttocks muscles tight, like you're holding your cheeks together, and then you're going to relax. Again, we're going to squeeze both glutes, both sides of the glutes, and then relax. Again, this is an isometric exercise, should not hurt at all. After surgery, we want some good circulation in the body. The quadriceps and the glute sets do help with that circulation. You might notice right after the surgery, your hip is a little swollen. It could also not only just be the hip, you might be seeing some swelling in the quadriceps, down in the lower leg, sometimes the ankle. So because of that, you are going to be doing ankle pumps. Ankle pumps are bringing the ankles up and then down, and up and down. These are ones you're going to do a lot throughout the day. You're going to be doing in sitting. You're going to be doing them laying down when you're in bed in the hospital. Again, it does feel good. You're also going to be doing ankle circles. When you do the ankle circles, you want to make sure not to break your hip precautions. So what hip precaution do you think she could break by doing the ankle circles? Anybody have any idea? Yes, so if she decides to move her hip in like this, that's not good. You don't want to rotate that hip in. That is breaking a precaution. So ankle circles are truly just with the ankle. You can do two. And you can do both legs at the same time. You just want to make sure your hips aren't rolling in. Your hips are fine to roll out. Just no rolling in like a pigeon toe. The next one is hip external rotation. So that's where both hips go out and then you come back to neutral. Both hips go out and then back to neutral. So neutral is your toes pointing straight up. Again, not rolling in. That's breaking a precaution. The next one is called hip abduction. That's where you take, you got the table? I'm going to help her with it just so she doesn't fall off the table. This is where she'd bring the leg out to the side as far as you can, and then coming back in to neutral. Again, not crossing the legs. It's going to be concentrating on the outward motion and then coming back to neutral. And again, that exercise she would be moving herself, but this isn't quite the best table for exercise, but we're making do. The next one is called a heel slide. And the first few days, your hip is going to be pretty stiff. So it is going to feel good to do this. This is where you're just going to slide your heel up as far as you can. Looks really easy now. You might need some help with it the first few days. And then going down slow and controlled. And then she would do it on her own. She would slide that heel up as far as she can. Again, she's not breaking precautions. Breaking precautions would have meant she went way up here. So that's the 90 degrees. So everybody remember geometry? 90 degrees. And remember the marble scenario that Julia told you, so then you'll remember where that is. and then slowly down. Okay, Julia's going to try to carefully sit up with, why don't you put your legs that way, so. And the next one's just called a long arc quad, and that's just lifting that leg up high and then down slow. And up and down. Okay, so now we're going to start from the beginning. We're going to do it in sitting. You don't have to lay on this table. You can pick one leg or two legs. You're going to put them in front of you. Okay, so we're going to do the quad set. Put one leg, your worst leg, forward, the one you might be having surgery on. Okay, good. Now you are going to tighten these quadriceps by pushing your knee down towards the floor. You should feel these muscles tighten. And then you relax it. And you try to push it straight. How's everybody doing on that? Anybody need a little help on that? Everyone's got it? Great. Okay, the glute set. You can do it in sitting. Again, once you have the surgery, you're going to be doing it laying down. So sitting, you're going to squeeze your buttocks muscles together. And then you're going to relax. And again, hopefully neither one of these that we just did hurts at all. You might have to come to PT. If it is hurting, we might have to give you some other things to try at home. Just come in to PT for 1 or 2 visits to try to give you a few things. Okay, the next one, the ankle pumps. It's the ankle coming up and down. You can do both together if you can, or one at a time. Again, in the hospital, you're probably going to be doing both because you're going to be laying in bed. Now we're going to do the ankles. Yes? Usually straight is a little bit better. If your leg is really swollen after surgery and once you get home, you could have the legs elevated and then do the ankle pumping, and that will help with the swelling. And we'll help remind you of all these things. This isn't the first time you're going to see these exercises or hear them, but it's so nice when you wake up after anesthesia and somebody says, okay, we're going to do quadriceps, and you're like, what's the quad set? You guys already know it. You're going to be able to participate in your therapy that much quicker, which is going to help you get better faster. So ankle circles. So we're going to the ankle circles. On those ankle circles, it is with the ankle only. We are not having that hip roll in at all. Just use the ankle. Good. The next one is the hip external rotation. You're starting with your toe straight up to the ceiling, and you're rolling the leg out and then back to neutral. Rolling the leg out and back to neutral. How's everybody doing? Some people might not have much motion in this. Your hip might be a little arthritic, just a little. Okay, hip abduction. That's where you're going to slide your leg out and then slide it to neutral, keeping those toes straight up. Slide out and slide to neutral. Okay, the heel slides, we're going to vary it because of sitting. You're just going to glide or slide the heel back and then slide the heel forward. That's going to help with some motion post-operatively. Okay, and the last one is that long arc quad where you're going to lift your heel off the floor and then down slow and controlled. And lift it up so you should feel it in the quadricep. Now, on the paper I gave you, I did give you the number of reps that you should be doing it. I also typed up how much time you should be holding each position and how many sets you should be doing, as well as how many times a day. So for now, for preoperatively, I would suggest a minimum of 3 days a week of doing these exercises to help build the strength. Post-operatively, you are going to be doing these every day, several times a day, especially when you're in the hospital. As at some point, these are going to be so easy for you, you're going to get other ones to work on. Again, you will get ones to work on based on your deficits and on your goals. So his question is, right now he's having some clicking, clacking, and he probably sounds like an old stair, right, every time you move. And the question is, can you just get up and walk? I'll let Julia talk to you about the inpatient part.
So right after surgery, you're going to be what we consider weight bear as tolerated, okay? And so that means we want you to put as much weight on that leg as you can tolerate. A lot of times people feel like that the hip isn't going to hold them. It is. It's going to hold you. Are you going to be able to walk your dog? Probably not the first week, but at some point, yeah, that's the goal. And that would be the goal that you would give Renee at outpatient physical therapy. You would say, my goal is to be able to take my dog for a walk. And that's what they're going to work towards. But right from the very beginning, like I said, we're getting you up that day. We want you putting as much weight into that leg as you can tolerate. A lot of the pain comes from the swelling and the inflammation from the surgery itself. Yeah, because there's a lot of, I mean, it's not just the socket, you know, there's an incision and there's tissue that has to be gone through. So a lot of the discomfort that people feel comes from the inflammation that is around that as well. It depends on you know, your own physical anatomy, but it's not going to be in a spot where you're going to sit.
A little more to the side.
Yeah.
And that's where the nice comfy clothes that Julia spoke about will make it much easier for you when you're toileting. A few of my friends who've had total hips, they liked having a dress on so that nothing was really touching their scar tightly, and they thought it was easier for them to pull things up than pull things down. But that's very individual. But that's why you don't want to have real tight pants that you're going to struggle with, because you will have the swelling like Julia had mentioned.
So that's a really good question. You know, as long as you're abiding by those hip precautions, you know, and it'll be up to Dr. Barrett or whoever the surgeon may be on how much, you know, you can lift. But generally, we don't give anything as far as lifting. So if you need to carry a toddler, as long as you're not still using your walker, then you should be fine. If you're using a walker and this is, you know, within the first 2 weeks, you're probably not going to be doing a lot of that stuff. So it'll be a lot of, you know, maybe games and coloring at the table, you know, and that kind of stuff, and having meals. But I would say the primary caregiving role is going to fall on mom for a little while. Absolutely. Yeah. So no getting down on the floor to play trains and trucks. And you know, you're going to want to kind of keep things as long, you know, keep the seating surface the same, but then bring the toys and stuff that they want to play with to the level of a table so that you can still engage.
It'll be good too if you can keep the toddler's toys in one area versus scattered throughout the house, because you don't want to be tripping over trucks and marbles and anything else that they might have. So the question is, before surgery, do you have to worry about the precautions? No. You're having...
It won't be dislocated by doing these things.
No. So your natural hip will not dislocate by doing these activities. It's just once you do have a prosthesis in there. So you can do any of those activities right now, no problem. Maybe it is a problem. So whatever you can tolerate is fine. You're not making your hip any worse by doing that preoperatively. You won't hurt it any more than it already is damaged. So the precautions are totally different for an anterior than a posterior.
So these
This one is specific for a posterior because here at Milford Regional, we haven't really been doing many anteriors that I've known.
I don't see many anteriors. I mean, they do come, but the vast majority of hip surgeries are the posterior approach. The posterior approach means that they're coming in from behind. So it's posterior lateral. They're coming in from behind and the side. And anterior, they come in from the front. So the precautions are a little bit different, but for the most part, I would say the folks in this room, I would guess, are probably looking at the posterior.
So the question is about cortisone injections, and now his pain has gone way down. And so now you're not sure if you should have the surgery. So by increasing your activity over the top, that could cause more pain in the hip. So usually you want to gently start going back into exercise. If you were able to walk a half a mile before the cortisone shot without a problem, start with a half a mile and slowly increase. Don't say, geez, I have no pain, I'm going to go 2 miles today, because you might be surprised what happens. So just gradually increase it, and you should gradually try to increase your exercise program in general to strengthen the leg. So that's a great question. How to decide when to have the surgery? Sometimes we have people who wait until they are in the wheelchair. They cannot move. This is not a good decision because you now have minimal strength in your leg. You have not been doing any cardiovascular exercise at all, and your rehab is super long. The surgeons always say, you will know when you need to have it done. They try to, have you go as long as possible, but only you know when you've reached the point of no return. When your personality starts changing, that's usually a good indication that you might need to have the surgery. That's one thing. But if you can't do the things you enjoy in life, that's another kind of way to determine if you should have the surgery. But your surgeon can help you decide and walk through that, because they don't want to rush you into something you're not ready for either. We have a lot of patients that do have a referred back pain because of the hip. Most people have been walking very poorly for a length of time, probably limping, may not have been using a cane or a crutch or anything. So we often do have people who have their back hurts, their knee hurts, their ankle hurts. And that's another reason to try to decide, geez, maybe I should get it done, because everything is starting to hurt now, because you're doing this kind of walking. And so that is not uncommon at all. Usually post-operatively, your back feels a lot better, but it takes a little bit to get your walking back to normal, because what your normal has been is not normal. We want to get you back to a nice fluid gait. It might mean using a cane a little longer than you want to, so that you don't have, we call it an antalgic gait. Use a cane to help you get in a normal flow. So I see everyone looks very excited to have this surgery. It's really not as bad as maybe we made it sound. Most total hip patients, if you've talked to any of them, they are so excited that they've had it done. We rarely have a patient that says, I can't believe I did this. Most of them say, I can't believe I waited this long. So there's a very, very high expectation that you will do awesome after the surgery. If you've had friends who've had a total knee replacement, that is a different ball game. Total hips recover much faster than the total knees. So if your friend scared you, my total knee, I've been working, doing exercises for a year, that's not the case here. You're going to have surgery. Most of you are going to say, this is awesome. I can't believe I waited this long. And off you go on to your life. Okay, you guys have been great. If you have any questions, Julie and I will be up here. Feel free to ask us. We're glad to help you with anything you need. Thanks for coming.
Thank you.
Bye.